Fatty liver disease. Fatty liver disease is a very common disease long ago in Western countries. But lately, it is not very uncommon to see people with fatty liver disease in Asian countries, and no exception in Malaysia. Fatty liver disease is a disease by when the way the name is we call it, we know that it is a disease of the liver, and this disease is usually present in many people, but they are not giving any complication in the beginning. Okay, so this disease is not a serious disease when it is at the early stage. Okay, what causes fatty liver disease? Actually, fatty liver disease is a disease where you have an excess fat that accumulate in the liver. When you take too much fat, the fat is not metabolized fully into usable material, usable energy, and so on. So they are stored in the liver, and sometimes the liver cannot afford to metabolize all due to certain complications, certain um, ailments, disease in the liver. So the liver cannot remove all the fat, so it accumulates in the liver. Okay, and people tend to develop fatty liver if they have certain other conditions like obesity, diabetes, or highly fat diet. So this is very important for us to know that excess fat can lead to fatty liver disease. Okay, every stage, early stage of the non-alcoholic fatty liver disease does not usually cause any harm, but they may lead to serious liver damage if it gets worse. Okay, non-alcoholic fatty liver disease is the disease that we used to get if we are non-alcohol consumers. We don't take alcohol, but usually people with alcohol, they develop fatty liver disease much more often or more easily because they take a lot of alcohol, which are also converted to fat in the end. And having high levels of fat in your liver is also associated with an increased risk of serious health problems such as diabetes, high blood pressure, and kidney disease. So we need to ensure that our fat intake is not too much, and it has to be metabolized properly so that there is no excess storage in the body. So this is very important, and we can monitor this through an easy way by looking at our body weight. Our body weight should not be in excess at any time. Okay, how do we eliminate this problem of causing fatty liver disease? First, we need to lose weight. That means we know what to do. We have to exercise, or we have to reduce our diet, and we have to be more active, and we have to adopt a healthy diet daily. This is what I mean by eating less fat and taking more proteins and um, good sources of healthy food. Okay, lead a more active life. You have to do more of movement activity so that more energy is utilized. And when energy is utilized, they also use the fat to produce the energy. If you are diabetic, you have to control the diabetes so that it does not lead to um, severe cases of diabetes and fatty liver at the same time. You need to lower your plasma cholesterol as well, okay, because cholesterol is also fat, and you have to protect your liver. This is very difficult to do if you are not very knowledgeable in how to go about doing this, because this involve a lot of toxic chemicals and food intake that can damage your liver. And also some herbs, if you take in excess, they may also affect your liver. What food can cause fatty liver? Okay, first thing, the easy way to do it, to know it, is to look at food which are uh, high in sugar, because sugar, when they are excess, they can also be converted to fat. Okay, sugary food such as candy, cookies, sodas, and fruit juices should not be consumed in large amount. They have to be reduced, and try to take food with no sugar or very little sugar. Usually, most food has already got sugar inside there in the form of carbohydrate, or sometime in other forms which is not sweet. So we are not really alert. So we don't know. For example, taking Coca-Cola is extremely high in sugar, but we sometimes do not realize that. This is very common. Okay, avoid too much of fried food, because fried food contains very high amount of oil, and sometimes try to cook without using so much of oil, or without oil. There are a lot of ways to cook without oil nowadays. Avoid too much of salt. Reduce white bread, rice, and glutinous rice. All this contains carbohydrate, where when we take it, this will be metabolized to sugar. And reduce red meat, because red meat also contains very high fat. Too much fat in the liver can cause liver inflammation, which can damage your liver and create scarring. Scarring makes the liver hard and not usable. Okay, they form like something like scar on the liver, and inflammation makes the liver useless. That means there are some problem with the liver when there is inflammation there. Okay, scarring can lead to liver failure as well. So all these are very important for us to make sure that we are in control. Signs that you may have more serious fatty liver disease include yellow eyes and skin, something like jaundice, bruising, dark urine, swollen tummy, vomiting blood in the serious case, and black stools and itchy skin. So if you have any of this problem, you may be having some fatty liver problem. And of course, it is not confirmatory. And losing weight is the best way to control or to reverse fatty liver disease. And this losing weight is a very, very simple way. It is not necessarily using medication, or do not require much chemical or physical intervention. So you can even just avoid fatty food. You can also do this. Okay. A good target is to lose 10% of your total body weight, but even a loss of 3% to 5% can be considered as good. Okay. Options can include diet, healthy lifestyle, weight loss surgery, and weight loss medication. I would not encourage weight loss medication so much. Sometimes it could be dangerous. And we have to take good and healthy food with less or no sugar, lower salt and fat. Okay, take more good proteins, and take a lot of antioxidants and detoxicating food. Avoid synthetic and processed food. Okay, synthetic and processed food usually have very high salt and very high fats, and food like burgers and hot dogs, some of them were not really of high quality. Most of the burgers and hot dogs in the market are made from fats and mixture of meat. It is not really of high quality unless it is a special brand or selected product. So this is very common. We can find this type of food everywhere in the market. Can sativa plus help in fatty liver? The answer is yes. Okay. To avoid fatty liver, you can consume sativa plus 2 or 3 tablets a day, which will help in the following ways. First thing, it has very strong antioxidants. The thymoquinone will be a good antioxidant to prevent all these damages, and it has a strong anti-inflammatory effect. It will protect your liver and prevent the liver inflammation and also the scarring that could happen due to inflammation. And sativa plus through thymoquinone has hepatoprotective effect. It will protect your liver. It has detoxification properties. The thymoquinone also induces production of glutathione in the liver, which helps to increase detoxification of toxic chemicals in the liver and ultimately in the body. It builds a strong immune system, which also plays important role in the liver function. So sativa plus will work in harmony in multiple prong effect, which makes it a very, very good agent for protection of the liver. And also it gives other good effect that I didn't mention here. It has several other good effects to the body, and that has to be done by taking sativa plus daily. So it cannot be taken intermittently.